Nursing home residents are highly vulnerable to the coronavirus pandemic, but a new government report says controlling infections in nursing homes has been a problem for years. Hello, I'm Len Cannon. That report confirms what KHOU 11 Investigates exposed last month at Houston area nursing homes. Here's Jeremy Rogowski with these latest developments.
Across the country, nursing home deficiencies for infection control were widespread and persistent prior to COVID-19. The Government Accountability Office found 82% of facilities evaluated were cited at least once during a 5-year period. In the Houston area, KHOU 11 Investigates had found 75% of nursing homes had at least one violation in recent years.
One example could be a simple basic thing of nursing home staff not washing their hands and working with multiple residents.
Other infection infractions involved not sterilizing equipment, not isolating sick residents, and staff working while they were sick. While nearly all the deficiencies were classified as not severe and enforcement actions were typically rare, doctors say the pre-COVID findings are a wake-up call as the number of virus-related deaths continues to grow.
We have to put a better emphasis on the fundamentals. And it's time, and COVID has made that blatantly clear. We have to master the fundamentals to help keep people safe and healthy.
If you have a loved one in a Houston area nursing home and want to check out its infection control history, we've made it easy for you online at khou.com/investigations. Just click on the facility where you can read the full inspection reports over the past 4 years. Back to you.